Andrew, welcome to Turkey, welcome to Klivet.
Thank you.
What are the new approaches in the treatment and pancreatitis? Why was there a need for innovation?
Oh, there's a lot of things that are going on with pancreatitis. I'm always very excited to talk about. I think there's three important things that we've recognized are really important for patients with pancreatitis. Number one is diagnosing it. It's really changed over the years. We used to use amylase and lipase, and we don't really use those anymore. We use more ultrasound or cPLI. They're not perfect tests, but they're a lot better than what we have had in the past. Number two is nutrition. We have a lot of evidence now that says nutrition is kind of paramount for patients recovering from any critical illness, especially pancreatitis. Whereas we used to say starve them, keep them off food. We don't do that anymore. We want to introduce nutrition really early on. Sometimes we have to place a feeding tube to help that happen. And the third is that there's some new therapies that are out there. In the US, we have a medication called Panoquelle or fuzapladib, which has shown some evidence. I think there's a lot more to be learned about how good of a medication that will be. It's kind of expensive right now. And we're revisiting some old things as well. Steroids, for example, for use with pancreatitis, maybe more so in cats. It was something that we had shied away from. We maybe thought caused pancreatitis in the past, and now it's being revisited as a therapeutic option. We think in cats it might be partially an immune-mediated disease, and so it might be helpful to suppress some of the immune system. And the last is there are some new emerging therapies which aren't available in many places right now, but stem cell therapy is, there was a recent paper just last year that investigated it and seems to improve outcome. It's not very available yet, but maybe something that will be available in the future.
Okay. Now is a very important question for me. What is the training monitoring rule? It's 20 points. It's very important. Why important 20 points?
Oh my goodness,
Emergency critical patients.
I love to talk about what I call the rule of 20. In part, it was my mentor who developed it, and we have subsequently written a book about the rule of 20. But it's 20 important points to look at in any critically ill or injured patient to make sure that we're not forgetting anything. It's not necessarily a differential list, but a way to approach a problem. So each of these problems, whether it's glucose or level of consciousness or pain control, are important in all of these illnesses. And we want to be able to assess the patient. So I kind of approach it like a SOAP for each problem. I do a subjective assessment, an objective assessment for things that we can measure, like glucose or blood pressure, decide what the problem is, and then, of course, treat it. And for every plan, we have a diagnostic, a monitoring, and a treatment plan for every abnormality, because we don't want to just, if a patient is hypoglycemic, put them on dextrose and forget about it, right? We need to know why they're hypoglycemic and investigate that. And so this kind of summarizes every critical point, although there's a lot of interaction between the rules of 20, like glucose and neurology, same with electrolytes and neurologic status. They all sort of interplay a little bit, but if we look at each one of them individually, we don't forget anything that we might be, that we might not be thinking about in the patient in that moment.
Now content and CPR.
Yes.
CPR techniques have been updated. Why is it important to update these techniques? Why is proper CPR so critical?
CPR has come a long way.
A big word is CPR.
In the last 20 years, we now have recommended guidelines and a training course that you can take to become certified for veterinary professionals as a recover-based training method and certification. There's two critical points. One is to standardize the way that we're all delivering CPR so we can all deliver it in the same way. It improves communication. We all know those points to look for to make sure our technique is really good, to make sure that we're doing it properly. It also helps us collect data. So a lot of centers are entering data to collect that information and see if we can do better in the future. We know that if we don't do CPR, they're already dead, so they're going to stay dead. But let's give it a try, right? And hopefully we can improve not only the techniques, but as we gather data, we can improve those techniques so we can have better outcomes.
Last question is Klivet. How is the Klivet Congress for you maybe, are you happy to be here?
Yes, I am thrilled to have come to Cyprus.
I'm
to
sorry,
help.
first of all, very, very energetic
Yeah.
presentation.
Yeah.
That's perfect. Thank you.
It is my passion to teach. I was in my hospital that I grew up in. It was a teaching program. We had interns and students and residents. And since then, I have expanded into national and international conferences.
Yeah.
I've had a great time here in Cyprus and with Klivet. I hope I can come back sometime. I've already spoken to some of your leaders about new ideas and projects for next time. It's been a great conference. I think the attendees have had a good experience. There's been lots of workshops that I saw and good titles for presentations about how to make our treat our patients better.
Perfect.
Yeah.
Andre, thank you very much.
All right.
Thank you for coming.
Yeah, of course. I appreciate it. It's nice to meet you.
Thank you very
Take
much.
care.